morning to all of you and a warm welcome for 68th AICUG TV. I'm pleased to have with me the prominent personality from Faridabad, and that's Dr. Maninder Ahuja. She's a consultant and obstetrician and gynecologist at Faridabad, and she's going to enlighten us on the topic which is very close to I think all women's heart, and how to maintain ourselves throughout our life for the well-being of the human being. She's going to talk to us on sport you are born, there is sport you. Ma'am, welcome to the ASUG TV, and we really thank you for accepting our invitation to be here, and we would like to have your key insight on this topic. So what would you like to say? What is your feeling for attending this Foxy at Ahmedabad?
Thank you. TV Amcure here, AICUG 2017. What Dr. Reshma said was she matters. What Dr. Alka Kriplani said was prevent the preventables. And what I say is your body is your first temple, worship it. If you don't worship it, you won't be able to climb up the stairs of any worshipping place, whether it's Mandir, Gurdwara or Masjid or church, it's there. So I'm talking about the same thing. Prevent the things, that is much better. Prevention is much better than the cure itself, and that prevention starts much earlier than we think it's possible. Sometimes the things they start in utero, so we have to start caring about the mother and the baby from that point onwards. But adolescent is a very, very critical period where the role of calcium, vitamin D, exercise, a balanced diet cannot be undermined in any other way. So what do? What we have to actually advise our patients is try to fulfill your requirements of calcium and vitamin D from the diet and from the sunlight we are getting. But supposing you are not able to do that, at that time you have to take the supplements. Now, as far as calcium is concerned, the requirement goes from anything from 1000 milligram to 1500 milligram. And green leafy vegetables, and I think all of us know the sources of calcium. But supposing if you are not able to fulfill, then you can take any calcium. Any salt is good enough. Calcium carbonate is also good because it has a more elemental iron than other. The only thing is that you have to advise to take the patients along with the meals. Now, as far as the vitamin D is concerned, we get lots of that in our country. Sunshine is there. But of course, none of us wants to become dark. Even our maids, my maid say, "Mummy, मैं dark हो गया." So that's the thing, that they have also worried about getting darker. So that's why we are not getting our proper vitamin D, which should be 9 to 12 am. If we expose the upper part of our body just for 10 to 12 minutes, that will be sufficient. But we are not giving our body that much of vitamin D. So that means we have to give vitamin D starting from anything from 400 international to 1200 international units. And in the elderly, if they are deficient, we can give even 2000 international units. So ideally, you give 60,000 units sachet or tablets are available, which you can give at one go, once weekly for 8 weeks, and then you can give the maintenance dose of once weekly or once in a month. So that is all about the calcium and vitamin D. Now we want to come to very, very important part of the exercise. That is where everybody needs a little pushing up, because here you have to move your body. And what we want to do is just move our fingertips for various controls, whether it's the TV or the remote or anything exercise there. So that's why we are losing our muscle mass. So now we have to exercise. Now, how many of you brush daily? All of you brush daily. Why do you brush daily? Because for the oral health, you understand that it is very important. So that brushing has been integrated into your lifestyle. Same way, you have to integrate exercise also. And exercise means you have to go beyond your daily walking. Walking is okay, but that's just giving you toning up, and it has to be a good speed so that you are not able to talk. So you have to add the weight bearing and resistance exercises also, and that means you should add weight when you are contracting your muscles, biceps, triceps, back muscles, core muscles. All those muscles, they have to be strengthened properly, then only your basic metabolic rate will be increased and you will be able to utilize more of energy and lose less of it. Exercise is very much important in PCOS also. So we start from the adolescent, we give them the first advice as the lose your weight 5 to 10% if they are overweight. It's important in pregnancy. You start doing Kegel exercises and some moderate weight bearing also, because you have to carry the baby later on. And postpartum, it's really very important to get back into the shape. And if you don't get back into the shape, you cannot get back into the society itself. So see how important it is to get back into shape. And for that, at least for 6 months to 1 year, you don't have to do calorie restriction at all, because you need 400 calories extra for the feeding the baby, lactation, and that is very, very much required. All the women, they should do the breastfeeding of their children. That's very important. But exercise, they should start immediately postpartum. That's very important.
Yeah, very well said, ma'am, that the calcium and the other various nutrients like iron or multivitamins, calcium, vitamin D, and to be supplemented with right exercise is important in the lifestyle of a woman for a better health being, not only of the woman but also if it is a pregnant lady, then for the betterment of the child's health. So all nutrient supplementation is definitely required. And we have various calcium salts preparations that are available. Calcium carbonate, having the highest elemental calcium, could be the one of the preferred calcium that could be used. And recently Endocrine Society has also recommended that the up to 2000 international units may be given in should be given in pregnancy, so that the developing fetus is not deprived of the enough calcium and vitamin D, because vitamin D also helps in increased absorption of the calcium. And equally, the exercise has a tremendous role to play, because that will utilize all our nutrients that we have absorbed and put us into the right shape, because every woman in today's era is also very much concerned about how do we look, especially postpartum. And who could be better person than you to explain us at you have maintained yourself so nicely.
Thank
And
you.
that's
Thank
really
you very
very
much.
nice.
Thank you.
And
So
so
nice.
we take a key message from your interview, that our body is a temple and we need to worship our body with a good balanced diet, and equally supported by a good balanced exercise.
Exercise is very
And
important.
that will take us to a long way to look very beautiful like madam. And so
And healthy. That's very important, to be healthy.
yeah, that's very
Healthy. So
important.
healthy aging is one concept which we are taking up now.
Yes.
Healthy aging.
And
So we should remain our mantra is fit at 40, strong at 60, and independent at 80.
oh, that's really nice. Thank you very much, ma'am, and it was really nice to have you with us on this 68th AICUG TV. Thanks for sharing very beautiful tips. I would say beautiful tips for the well-being of the woman. And from MCure, we would like to present to you a guidelines booklet. This is a booklet on the management of ovarian hyperstimulation syndrome, which very often you must be coming across in your practice while treating patients for various ovulation with various ovulation inducing drugs, whether in IUI or IVF practice, and the latest guidelines on reducing the risk of venous thromboembolism in pregnancy and puerperium. So these guidelines are adapted from the recent RCOG guidelines. We hope that this will be helpful for your academic purpose.
Of
Thank
course,
you very much.
it's good, and I'm really thankful to MCure for taking up this CSR, social corporate responsibilities of the company. Thank you, MCure, and thank you AICUG 2017 for giving us this opportunity.